Hello, everyone. Welcome to this parallel session under the theme Short and Long-Term Impacts of Climate Change that will be focused on the challenges and needs within the topic of extreme weather events and physical and mental health. It's great to see all of you here in the room, and just come up here in the front. There are more seats here for those of you who are just joining. As we discussed earlier today, this conference is about identifying knowledge gaps and what needs to be urgently focused on, as was said earlier today by Marc Lemaitre. My name is Miriam Stackpole Dahl, and I'm happy to be moderating this session today, where we will hear from our four excellent speakers, placed some on this side and some on this side. We will be covering temperature-related mortality and morbidity, climate change and mental health, maternal and child health, mainly in the context of low and middle-income countries, as well as experiences of extreme weather events and how to respond to its impacts from the Belgian province of Antwerp. Following initial short presentations by each of the four panelists, we will have a panel discussion, and there will also later be opportunities for questions and answers from the audience. So I hope you still have the Slido access for that. Before turning to our speakers this afternoon, I just want to briefly introduce myself. I'm a senior communication advisor at CICERO Centre for International Climate Research in Norway, where the last years have mainly been working on climate change and health, working to bring together climate change and health researchers and communicate climate change impacts on health from projects, research projects that we have been involved in particular exhaustion and unwell projects funded by the European Commission. And I'm therefore glad to introduce the first speaker this afternoon that I have gotten to know through the exhaustion project. He's sitting here. Dr. Antonio Gasparrini is Professor of Biostatistics and Epidemiology at the London School of Hygiene and Tropical Medicine. He leads the Environment and Health Modeling Lab and has pioneered epidemiological designs and statistical methodologies for climate and health research. He is a strong advocate of open science and reproducible research and has contributed to this development of freely available software, tutorials, public code repositories. The floor is yours, Antonio.
Okay, thank you very much, and thanks everybody for attending this session. So I will be hopefully very brief, and I will focus on a specific aspects of health-related impacts of climate change through exposure to non-optimal temperatures. So both heat and cold. This has been studied for a few years now, and we have a clear pattern about what's going on around the world, and in particular Europe. Just to give you an idea, we ran an analysis on the urban population in Europe, and we found out that each year, in the first 20 years of this century, approximately 14,000, and 130,000 deaths are occurring every year due to heat and cold. So it's a substantial amount of deaths occurring every year. Okay, can you hear me now? Yeah. Sorry about that. However, an important aspect of when looking at this is that there are striking differences across Europe and the whole the world about these impacts. And in particular, there are both regional differences. They are mostly due to difference in the hazard level. Therefore, exposure, south of Europe is much more exposed to hot temperature, of course, for example, but also, of course, acclimatization. But more interestingly, there are also very important local differences across small areas and possibly also within the same city. And the way we interpret this is a differential vulnerability of population. So people are more resilient or not to heat and cold. And therefore we have from here two takeaway messages. The first one is that we need both national policies but also local policies complementing this, because some places and some subgroups are more at risk than others. But more importantly, probably most of these excess deaths are preventable. And therefore we can, develop adaptation policies to reduce the risk, especially in the future. Now, the second part is what will happen in the future. And of course, we have projections of impacts under specific climate change and socioeconomic scenarios. And in this case, we had to fight this controversial question about if decreasing cold-related deaths will, in a way, outpace, in a way, the increase in heat-related deaths. And therefore, eventually, as somebody is still mentioning in social media, climate change will be a good thing for us because we'll have a decrease in mortality due to an optimal temperature. Now, we run an analysis which is currently ongoing. There's a poster from my colleague Per Marcelot on this about this analysis of this so-called net effect, that is the looking at the differences in heat and cold deaths in the future. And the picture is very clear. Under all scenarios of climate change and socioeconomic pathways, there will be an increase in net mortality due to the big increase in heat-related deaths in the future. But these will be even more extreme under more extreme climate change scenarios. So again, takeaway messages. In this case, they are much simpler than earlier. Climate change is bad for our health, definitely so. And second, there should be an emphasis on mitigation in addition to just adaptation, because we see clearly that the benefits of it in terms of reducing drastically climate change increase and especially emissions, of course, it will be beneficial for our health. I will finish just with the current frontier, let's say, in research. What we are studying even now is to understand what are the drivers of these different susceptibility and vulnerability in the population, therefore helping to shape adaptation policies which are effective and can be implemented and actually resulting in a clear impact in reducing health effects of climate change. Thank you very much.
Thank you so much, Antonio, and thank you for your clear messages. We will move to the second speaker in this panel, who will cover a topic that we have already heard today. It's under-researched. I would like to introduce Dr. Emma Lawrence, who is the mental health lead and lead of the Climate Care Centre at the Institute of Global Innovation, Imperial College London. Her work focuses primarily on research, policy support, education, and intervention design at the nexus of climate change and mental health. She also works with digital mental health charities and with a focus on co-production with young people. Emma, over to you.
Thank you so much. So it's really a pleasure to be here and to see mental health be spoken about so much already today. The sad reality is that the reason that awareness of the mental health impacts of climate change are rising is because this is a need that's being experienced by a growing number of people around the world whose lives and livelihoods are being increasingly affected by fossil fuel-driven catastrophes. But this is an historic moment for the EU to create an agenda for priority research in climate and health. And my key message is that mental health must be given parity of esteem with physical health in this agenda. Climate change is a risk multiplier for mental health. By increasingly burning fossil fuels, we're directly exposing people to acute and long-term traumas and destabilizing the conditions needed for good mental health and well-being. And this can look like directly experiencing high temperatures. So we know that people who experience mental health conditions are more likely to be one of the people who die in Antonio's data sets. 8% of the people who died in British Columbia in 2021 in the heat dome were diagnosed with schizophrenia. That's much higher than the general population. So we know people are at increased risk, and we know that by experiencing the trauma of your home burning down or being forced to move because there's a flood, that these have long tails for mental health. And this has been underappreciated and not considered when we count the costs of climate inaction. And this cost has now been estimated economically to, in 2050, be up to over 500 million SUD per year for the mental health extra burden of these escalating events. But also this looks like people forced from their homes. This looks like people's cultures being destroyed. This looks like people being disconnected from their lands. This looks like air pollution increasing the risk of anxiety, depression, schizophrenia, and even, sadly, deaths by suicide. This looks like a compounding stresses and hazards that lead to economic insecurity, food and water insecurity, sadly more cases of violence and domestic violence, interrupted education for young people. And so this is all compounding stresses that we hear and look at in silos, but ultimately the mental health and well-being of people is being affected. And listening to this, you might all be having your own psychological response to that. We hear all the time about the climate crisis, and what we're seeing now is that there's an interaction between awareness and experience, such that we know the people who are experiencing these effects are the most worried about not just what's happening now, but into their future. They're not just having to recover from this event, but from compounding events, and not having as much time to recover before the next one hits. So how do we get out of this vicious cycle? What we can do is switch to a virtuous one by seeing the interconnections between climate change and mental health and their common drivers, including fundamentally in how we're burning fossil fuels and creating all of these challenges in the first place. There are strong synergies between what we know from mental health research is better for humans and what is better for the planet. If we have more resilient and connected communities, if we have cleaner air, if we have tree cover and green space in cities, if we have more active transport, if we have healthier food, all of these things will protect and nurture people's mental health and our climate. In response to the significant gaps in research on climate and mental health and the disconnection between disciplines and sectors and geographies that has meant this has been underappreciated and not responded to, the Connecting Climate's Minds project, which has been Wellcome funded over the last year, has conducted over 21 dialogues with over 600 experts, including those by lived experience, in over 80 countries. And we've brought in particularly the experiences of youth, Indigenous communities, and small farmers and fisher people. And we're developing inclusive agendas for research and action on climate change and mental health, including priority research themes that we'd love to be in dialogue with the Commission to make sure that are reflected in the agenda. So thank you very much, and I just hope that we can, as Marina also spoke, take the opportunity to create a future that's actually much better for people at the same time as being better for the climate. Thank you.
Thank you so much, Emma, and you were pointing to some concrete suggestions for the Commission. Perhaps we can get more into that in the panel discussion afterwards. Now we will move to the next short introduction. Dr. Jai Das is an assistant professor and assistant director in the Division of Women and Child Health at the Institute for Global Health and Development at the Aga Khan University in Pakistan. His research interests include maternal and child health, nutrition, and infectious diseases.
Thank you. Thank you, Miriam, and thank you for this opportunity to share my experiences. We've been discussing the impact of climate change, and all of us are aware what climate change is and how is it impacting. So I'll just quote one example from my region that I come from, South Asia. It's one of the regions which has the highest temperature change, and it's far greater than other regions of this world. And one of the extreme weather events, which was floods in the year 2022, those were the floods of a massive scale, and roughly 3/4 of all the land of Pakistan was affected by flood, and it affected a population of 33 million, I think, which is 3 times the population of this country. So 33 million people were affected, and from these 33 million, 16 million were children, and I think more than 600,000 were pregnant at the time. Women were pregnant at the time of these floods. So you can see the massive scale of this destruction, and also see what grave impacts it could have, not only on health, but on the livelihoods and on regaining back to their normal lives. How long does it take? And it's been more than 18 months now, and it's still, when we visit those areas, we can very obviously see that the impacts are still there. So, having said so, climate change, as mentioned, has both direct and indirect effects on health. We have been discussing, hearing about this throughout today. it has various effects, including from infectious diseases to non-communicable diseases, to impact on pregnancy, to impact on mental health. One aspect that we also has been studied, and there is global evidence, that it also increases violence, the gender-based violence. And as usual is the case, the most vulnerable, women and children, are still at the brunt of this climate change also. So whether it's extreme heat, whether there are floods, whether there are storms, droughts, women and children are the most vulnerable populations, and they have to bear the most or the maximum consequences of this. I'll just give you a few examples how this happens. When this happens in flood, so there were areas in Pakistan in which you could see the houses were completely flooded. They were knee-high water in their houses. But the pregnant women were not allowed to leave the houses. The men left the houses, they went to shelter homes, the children left because of the socio-cultural dynamics. They cannot let their women go out or be uncovered and cannot leave their households. So even pregnant women were living in their knee-deep water for months. And one other example is that extreme heat. So Pakistan is one area where we have seen obvious rise in temperatures. And what happens is, even in the metropolitan city of Karachi, so Karachi only is a city of more than 25 million people, and there are urban squatter settlements there which are very congested, narrow. There are 3-4 story apartment buildings which are just close to each other, which means that you can shake the hands of the person living in another building on the 3rd floor. So they're so narrow, congested. What happens is that men usually go out, they sit on the streets when it's warm, but women, they cannot go out. Even if it's damp, they don't have any ventilation over there. And on top of that, in this extreme heat and sometimes no electricity, they even have to cook in those environments. So the extra exposure that they have, we talk about clean or unclean, that's another topic, but the extreme heat effects that they are getting. So these are just a few examples of how the population, apart from the socio-dynamic factors, the other prevailing issues, also the most vulnerable, the women and children, what cultural or social-cultural issues that they are facing, which could have been easily avoided, and they don't need any financial incentives, they don't need any, for a country to be developed. It's simple behavioral changes or acceptance at a level that could at least give some respite to women. One thing more that I would like to add is that we have been reviewing this literature. So this is an area that has interested us for the last 2 or 3 years. We have been actively working as an institute, as a university in this area. So we started exploring literature, what's there. And what we found was that this has been discussed during the day-to-day also, this sparse literature. And when we see there's very few literature coming out from the developing countries, let alone the interventions, because there are hardly any evidence on the effectiveness of any interventions or any health outcomes. But even if you look at what are the effects of various climate hazards on various health outcomes, you would see that there is minimal or absolutely zero evidence coming out from many countries which are bearing the consequences. So I would just like to close this opening talk by saying that we need to come up, we need to think as researchers, as various people who are working in this domain. I think there's a need to think on, first thing is for sure, there is no universally acceptable one solution for all problems, because climate change has various consequences and it varies by countries. Like for Africa, 33 degrees is a high temperature, but in our region, 40 and 45 degrees are regularly observed in many parts of the world. So obviously the effects, the mitigation strategies, the adaptation would vary. So we cannot do research in a few contexts and say that we'll have a universal answer to this. This is absolutely not going to happen. Secondly, we need to come out of our conventional research methods. We cannot do, I understand, and we have been doing this. I'm a scientist by myself. Randomized controlled trials are the gold standards. But we cannot wait 3, 4, 5 years from now on to get the answers, whether what works, what doesn't work. So I think with this routine stuff, we need to think of some rapid ways of finding solutions, finding ways in which we can help mitigate the effects, because climate change effects are fast escalating beyond the thoughts of many of the people who have been even working in this area for decades. Thank you.
Thank you so much, Jai, for your introductory words. I'm sure we will get further into the discussions on these topics after our last panelist introduction. I'm happy to welcome Professor and Dr. Cathy Berx. She is the governor of the province of Antwerp since 2008. As a commissioner of the Flemish government, she is, amongst other things, responsible for the administrative supervision and coaching of the local authorities and Social Assistance Council. She also fulfills, amongst other things, tasks concerning the maintenance of public order and security, as well as the prevention and combating of large-scale disaster through the coordination of the various emergency services. She is also the chair of the General Council of the Institute of Tropical Medicine in Antwerp, after being the chair of the board there for 14 years. She is also chair of the non-profit organization Bolster, as well as the Flemish Road Safety Forum, just to mention some of her key responsibilities. Cathy.
Thank you so much. Great to be here. And I'll try to just, in a few words, say something about how we tackle these big issues in the province of Antwerp. Of course, first of all, we are very well aware of the dangers of climate change and its impact on physical and mental health. But there is a paradox in the sense that climate disturbance and the extreme weather conditions they provoke make people extremely vulnerable and anxious, but nevertheless we feel and we see that the sense of urgency, both in politics and in public opinion, remains limited after all to really do and tackle these issues. So many policymakers avoid being frank, open, transparent about the seriousness of the situation and the need for drastic transition. So actually, we still miss a clear path from the as is to the to be in a social just way. There's a Belgian aphorism between policymakers. They mentioned, "I know how to save the planet, but I do not know how to be re-elected after I do what is needed to be able to save the planet." Which of course make it even more different is that those who are hit and affected and hurt the most are the least responsible for global warming and climate disturbance. Moreover, their voices weigh the least, which is of course a problem. Secondly, we plan, we make huge amount of plans, we write reports with recommendations, with policy plans, measures. You see them, some of them. Of course, we also focus on mitigation and we try to adapt in the sense that we try to realize wind turbine projects. We try to adapt, we make sure that the de-sealing of play yards are realized. But again, it is too little, too late. First of all, there still is a huge social resistance against wind turbines. The underuse of the available capacity for solar panels, for heat recuperation and heating networks in industrial clusters. As I mentioned, we adapt and we invest in nature-based solutions with the Blue Deal, with waterproof, green oasis, as the de-sealing of paved and sealed playgrounds is named. We also invest in modal shifts, in biking highways, in walking conjunctions. But again, it remains too little, too late. There is still huge resistance, also from farmer protests. I do not know whether some of you were in Antwerp last week and the weeks before, but still huge amount of protests against the necessary transitions and also rearguard fights. There is a car business in the sense we invest a lot in cycleways, but cars are getting bigger and taller, which makes it quite complicated to have more space for pedestrians and for the use of the bike. We monitor the quality of water, air, soil, we follow it up, but again, it's too little, too late, so we miss a consequent enforcement. We do research, we try to identify the gaps and focus on we try to identify the gaps between what is need to be done and also what is really be done. As mentioned, we monitor, we research, we do care, but I end with the last word. We struggle. We really struggle with the translation and the implementation of the urgency agenda. there's no time to lose, but due to a profound lack of general support, also in society, sometimes it's about prevention paradox. You mentioned the importance on how to have the policy, and we know that prevention is key, but how can you mobilize lots of money if you cannot prove that, after all, maybe you prevented something, you cannot prove it. So there is a prevention paradox. There's still also a state of denial, established values and interests. So the biggest issue is we still don't manage to translate and implement policy plans and general measures and ambitions in the recalcitrant reality of the physical world. And so also we also had, as some other countries, the climate case in the Court of Appeal of Belgium, in which Belgium was also condemned for having more ambitious goals on the reduction of the greenhouse gases and the emission thereof. But still, there's a long way to go. And maybe, which is one of the questions also for the European Union, is all the policy, also in agriculture and some other policy, is it congruent with the Green Deal and with the policy which is needed to also tackle the climate change and also the global warming? That's it. Thank you.
Thank you so much, Cathy, and thank you to all the speakers for your introductory words. I would like to encourage all the audience in the room to post your questions on Slido, so we can have that up after a while. I will also encourage all the speakers to respond to each other's comments. If you have comments, questions to each other, please let us know. And I would like to start with a question for you, Cathy, bringing it all your experiences back to what we are discussing here about what is needed in terms of research and knowledge. From your perspective of policymaker setting, what research is needed urgently to further support policy for adaptation to extreme event and prevention of the physical and mental impacts of your citizens?
Thank you. Well, I think I mentioned at the end the still serious gap between what needs to be done and what's really done in the physical world. So I think there's an urgent need for more and better implementation research in motivation psychology, in political and social science and social governance. For me, the 1 billion question is, how do we close the gap between what we know that needs to be done and the consistent and persevered realization thereof in a social, just way? How do we reach a new social contract? We also mentioned it's like a procession of Echternacht, 3 steps ahead, 2 back. So how do we convince the broader society in times of polarization, of fake news, to really realize that structural transition in a social, just way? We probably also need some more imagination to empower people and help to fulfill also the basic psychological needs on autonomy, competence, and connection. But of course, the policy is where it all has to start and where it all has to be fulfilled. And I think that implies at least 2 things: is the full internalization of all the external costs. External cost in the sense of environmental cost and the health impact of the policy or a lack of policy in the price of all goods and services. So only the right price with full and correct internalization of externalities will lead to a considered and right decision about production and consumption, to less food and other waste, I think. And what also is needed is a full transparency, invested interest values at any time for as many people as possible, to understand better who slows down necessary transition processes and earns how much on business as usual. So I really think that that transparency, and also, as I just mentioned, is there always a congruence, consistence between the different fields of policy? Don't we need a more integrated and integral policy to make sure that we really realize the Green Deal and all the other measures that are very well taken into place? But how to get there in the physical world.
Thank you so much, Cathy, for sharing those encouragement for what is needed going forward. One topic that I think was touched upon by several of the speakers today and also earlier today was the question of vulnerability. And I wanted to start with a general, for all the speakers today, what is needed to decrease the vulnerability. I don't know if anybody wants to start on that.
Well, okay. Well, I will also take the opportunity to reply to the last question here about what are the drivers of this heterogeneity and therefore differential vulnerability or resilience across the European countries, but also the world. Basically, we have some evidence of some of them, but the way we have modeled this so far is to take all a series, let's say, of potential factors and including them in this kind of predictive model to understand differences. So at the moment, we have done more about mapping exercise, which is very useful because it can identify high-risk population and high-risk areas. But what we don't know yet completely is a characterization of the role of these different factors, and there can be many, climatological, for example, infrastructural, thinking about urban heat island or green areas in cities, or, for example, socioeconomics. And we have some evidence, as I said, for example, the primary one is air conditioning, which is controversial, as we know, but it has been proved to be related to a decrease in heat-related risks, not as much as we think, actually, and the quantification of it is also important because every policy will have a price and a cost, and therefore understanding how cost-effective it can be, I think it's really important, and it is something that we need to model directly. So it's not just pointing out the different drivers, but it's also providing a quantification of the role. Of course, as I said, there are others. The decreasing of urban heat islands, for example, amount of green space, solutions of that type, I think they're really important. I think what I should say, much less is known, and there are some conflicting results on socioeconomic drivers, because this will be the first thing we think about, that wealthier in our areas are less at risk, is not that neat in the data we have. There is some evidence, but it's not that clear. So I think, as I said before, this is the frontier of our research at the moment, identifying the drivers and putting a quantification of their independent effect of increasing vulnerability and resilience.
Hi, should I answer this question as well, or would you like to go to another one? So I think that the question around vulnerability and around adaptation is somewhat linked, so I might try and answer them both together because I can see one around adaptation. In terms of vulnerability, it's, again, there's a lack of data clearly broken down for the different groups experiencing the mental health impacts of the climate crisis, and understanding what are the factors that confer vulnerability or resilience. But what we're hearing and what we see in the evidence to date and what we're hearing in the Connecting Climate Minds dialogues is, as we might expect, the climate crisis, both for physical and mental health, is multiplying risk. So it's the communities and the individuals who are already more vulnerable. So it's the groups you might expect. It's the women, it's the children, it's people with disabilities. We've heard people sort of with disabilities talking about the extra fear of being stuck in their home when an extreme weather event hits because they can't move or they can't flee as easily, and that has a big mental health toll as well. We hear about Indigenous communities, farmers, people working outdoors, people with strong connections to the land, and I could go on. But in terms of how we protect them, of course, first of all, we need to make sure that we understand their needs with both qualitative and quantitative research. We mitigate climate change first and foremost and try and reduce the inequalities. And we know from the IPCC reports that actually the countries that have higher income inequalities also have higher emissions and lower well-being. So again, there's a co-benefit to reducing inequality, that it can improve mental health and well-being and reduce emissions. But in terms of what mental climate adaptation would look like and how we reduce the vulnerabilities of individuals, communities, and systems, first of all, we need to see that there are, again, co-benefits at all of these levels. So at an individual level, how do we increase psychological resilience of people who are exposed to these risks? And we know that education can be part of that. We know that in the UK, for instance, and I know around the world, people are saying, well, we need to educate children and young people about the climate crisis because every job in the future will be a climate career. Every life will be touched by this, and yet we're not integrating mental health within that. And again, there's a win-win of helping them learn to sit with these difficult emotions and to acknowledge that learning about the climate crisis will come with these psychological responses and somewhat difficult emotions and distress, but that's normal and understandable and healthy. But again, build that psychological resilience within our systems. At a community level, what we hear and what we see in the data is that a big difference between, and we heard it earlier, between whether a community continues to thrive after a disaster or can cope or not and has a longer-term mental health risk is often about the connectedness and that social support within that community. And we know in general that social connection is so vital for mental health. So it's that ability to increase the connection and support within and see the healthcare system as beyond the walls of a health institution and extending into the community. And enabling people to be involved in climate action and have participatory governance. So again, societies with more participatory governance, more opportunity to be involved in collective action is better for both mental health and the climate in the evidence. And at a systems level, we know that changes to like having cleaner air, having more food and water insecurity, having more access to green spaces, having more active transport. These are some of the changes that we need to push towards a safer climate, and they're the things that would also benefit mental health, both in terms of mitigation and adaptation often. So tree cover in cities, for instance, is cooling. It starts to mitigate some of the health risks of heat, both physical and mental, but it can, so it's part of adaptation for the climate, but it also has these big co-benefits for mental health anyway, because when you live in greener spaces, that's better for your mental health. So I'll stop there, but there are hopefully some examples of the kind of things we can do. But we need more, just to say on a research conference, we have very little data actually looking at which actions would have the biggest and best impacts for mental health and well-being and how we quantify that, and actually what metrics we even use to quantify that. So we need to first develop the standardized metrics and outcomes to enable us to look at these hidden benefits of climate action for mental health, as well as the hidden costs of climate impacts.
Thank you. I want to turn now to Jay. You were mentioning vulnerable groups in your intervention as well. And I want to like to hear a bit more from you on what is being done in the context of developing countries to understand these effects of climate change on maternal and child health, in particular, as that is your topic.
So unfortunately, not much is being done. And because all of these countries, these developing countries, they are engrossed in so many problems, which includes, after the COVID-19 pandemic, the cost of living, the socio-political instability in those countries. On top of that, these countries are also conflict-prone or affected by conflict. There's so much going on apart from this climate change. It's in a situation of polycrisis. And so the policymakers with those limited resources and even people who are working in various areas, all stakeholders, I think there's too much going on in those countries, especially if you see in the last 3-4 years. Because we've seen the conflict has been rising, the cost of living has been rising, there has been social political unrest in many countries in those regions. Having said so, it doesn't take away that we shouldn't focus, we shouldn't do something for these women and children. So what I've seen is over the years, at least there has been awareness. There has been awareness at all levels regarding climate change. If you talk to the communities of the rural areas, of far distant areas, even they now know what climate change is because they themselves are experiencing. It's not their reading, because they themselves are experiencing the effect of changing weathers, like the extreme heat. They know the heat is far more than before. It's affecting their health. It's the shift in weather patterns, this change in precipitation and rainfalls. It's affecting their agriculture. And local farmers, when we talk to, they have been doing this for centuries, but it's something, their livelihood, they learn from their fathers and grandfathers. But now they don't know when to sow and when to reap because the weather patterns have shifted, the rainfall patterns have shifted, and people now are confused. And so one thing is for sure that everybody knows now, but climate change is a reality. Everybody does agree with this. There are very few misconceptions around it. The policymakers, the government, even in the recent elections that we had in Pakistan, there were politicians talking about climate change in their election rallies, in their speeches, even when talking to those rural populations. So one thing you can say is good that there is awareness, and even the government are forming these various think tanks within those countries to see what can be done, what couldn't be done, and even the academic institutes. So they have also gotten together. They formed these stakeholder groups, and they are working. We, as I mentioned, we have been working in this mother and child health for a long time, but especially got interested in the climate change in the last 3-4 years. And currently we have a few big grants, and in one of those we are looking at what are the biological pathways of the impact of extreme heat in pregnancy, because there is evidence that shows that exposure to extreme heat in pregnancy leads to low birth weight, small for gestational age, preterms, even stillbirths. But we are still not sure what the pathways are, and even that effect, the evidence that we're talking about comes from retrospective evaluation of previous data. So what we are doing is we're following a cohort of women, pregnant women. It's a big cohort that we are following, and we're understanding what are the pathways through which these effects occur. Because once we are sure what pathways those are, then only we can find strategies on reducing those effects. So one thing is that we're doing, we're also looking at what could be the various adaptation and mitigation strategies at the local level that people could accept. It could be something which is sustainable, it is cost effective. And what we are doing in that, as we've recently started on this, we're talking to the communities. Because I think what happens usually is that usually the communities are the passive recipients of whatever policies and programs that are made at the higher level. So we're engaging with these communities. At the same time, we're also engaging with the stakeholders at the same time and finding ways on how which we can mitigate the effect, because we cannot rebuild the infrastructure altogether. So those buildings are there, those structures are there, those cramped houses are there. We cannot change everything. So we are finding ways on what small innovations could be done within those existing structures, which could at least reduce the temperatures within those households and give less exposure. So these are some of the things that we are working on. And even at the government level, at the higher level, there has been greater awareness. People are getting together at the government, policy, academic level, working on even agriculture, finding climate-resistant crop solutions. So the work has started. After this realization. The work has started in various arenas, and I think the future will tell us whether we'll be able to find some solutions which could be adapted, which could be applied, and which could be scaled up in this context, and if it could have some meaningful solutions. Thank you.
Thank you so much. I think you already started to respond to some of the questions that have come in from the audience, but I think we can take a few more of those as well. The most popular question at the moment looks like this one. How can we reconcile long research timeframes with the urgent need for answers and solutions? I don't know if anyone wants to respond to that.
Yeah. Well, I don't have a complete answer to this, of course. This is something that we are exploring. But I think, as I mentioned, talking to stakeholders right at the beginning, talking to this policy. So the policymakers know what's going on. So they should be the partners in all the research that we are doing. And so they can even have their input. They can also see what's feasible, what is something that is acceptable, and could be scaled up or financed at this level. The communities should also be involved, because ultimately they have to take those interventions. And if they are not ready, and if they are not, they do not buy that intervention, So all of that effort could go in a waste. So I think involvement of all stakeholders at the very beginning, and secondly, serial evaluations of what's working, what's not working. These are some of the ways in which I think we could find something which is effective, and at the same time we can also have all the stakeholders on board, so that once it's proven, we could easily scale it up in a rather shorter time period compared to our traditional ways of doing things.
Well, I would like to mention and also to question a bit the way it has been framed, because science is actually provide a full-fledged solution at some point in the future. Science is incremental, meaning we progress further with the knowledge, and we can probably start contributing in just a couple of years' time on a question we pose now. Of course, probably not in the most definite way, but it will come at some point. And I can make a comparison with the research on air pollution, which is much more advanced if compared to what we are studying now, for example, temperature, flooding, etc., in which, we started gathering evidence, we established air quality guidelines, we established legal limits, and then they are advancing, and the WHO now lowers the limits because there is evidence that even at low level, now these are harmful, these pollutants. So we advance together with the science. So policy and science go together, and they're not. The science doesn't necessarily lag much behind. So I think it's important to bear in mind that we can have solutions with partial answers probably just in a few years. We don't have to wait 20.
Yeah, thanks. I'll just quickly add to that, because I agree with what's been said, that one of the keys is forging the connections so that when we have solutions that already exist between disciplines, or different methods for doing research that exist across disciplines, that we can join forces to do things faster and better, and make sure that once we know something in one part of the world or in one discipline or in one sector, that that's being shared. And I know that's come up a lot today, but what we see at the Climate Care Centre is really that need for connection so strongly in the climate and mental health space, but it's hard to get funding to build those infrastructures and maintain that capacity building and maintain that convening power and that connecting power, but we think it's so important. Also learning from what we already know. So there's already people, as we've heard, adapting to the climate crisis, living with these experiences and coming up with interventions around the world. But in climate and mental health literature, there is almost no evaluation of these interventions. They're already, we know Indigenous communities who have worked with are already coming up with solutions and say that they've had to live through colonization, and climate is just an extension of those experiences. So how can we be learning from what already happens? But that requires connection. It requires us to understand each other's terminologies, languages, etc. So we need investment in the infrastructure that would enable that really rapid translation of research into policy, but also to be testing as we're going and learning from each other. Thank you.
Thank you so much, Gemma, and Antonio as well. It's an interesting discussion. I would like to take one more question here, which is about in the same area, and that is, what is needed to bridge the gap between knowledge and policy, and what arguments are the most effective to persuade politicians, especially at subnational level? Anyone? Antonio?
Well, situations like this probably are the best option, in which we have both politicians and scientists in the same room, and maybe we talk together. We can definitely, there is lately an expectation that us as scientists are able to convey a kind of fully complete political message or policy in a way, and of course we can't, because it's not our job. But I think creating frameworks just like this, in which the scientific messages and evidence are taken and discussed and translated together, I think it's very important. And of course, it's probably public pressure and need for answers and solutions.
ahead.
Yeah, just a small. I'm really not a politician in the sense that I'm a civil servant, but what I try to do is to meet with as lot as mayors as possible, so to make sure that what's the quality of the environment that also improves and what is the impact of it, and just go step by step and make that you have multifunctional good steps ahead within the frame of very good directives and legislation of the European Union, but make sure that you apply it, that you show to the people and do it in a co-creative way. That's where we focus on a lot, co-creative. So you have challenges, but the moment that you look for and are searching for good answers for difficult questions and challenges, together with the population to make them more anti-fragile, so to make sure that they also feel connected and that they can contribute in a positive way to change their environment in a more adaptive way to how to deal with weather extremes and so on. That are the steps forward. But it's not that easy to do so and to continuously do so, and also to confront local politicians and also from higher levels with what is the impact if we have to lower down the emission of green gases, step by step, show the graphs whether they are going in the right direction, in the wrong direction, what can help, and also exchange of good ideas, as just mentioned. And what I hope for the most is that indeed, bottom up, the demand of real and good measures that people are really asking for, do something, make sure that also our environment is changing in a positive way, that we can just go in a safe, secure way by walking, biking, so many things. So many good things are happening. It's just continuation, the enforcement of it, and not loosen the moment.
Yeah, I think one challenge is, again, this siloing of decisions, right? And it's so wonderful to see people coming together, because often we see, even if there's a win for mental health, if someone is paying for the intervention in another department, it's quite difficult to bridge that gap, even within the policy space. So we see actually at local levels, at local councils, which have control over the budgets more, sometimes it's easier to do those things. So I think the challenges might be different at different levels. But I just wanted to come back to the point several people raised about public pressure on politicians, and you were saying that there is a gap between the urgency you see in the science and what's happening in the public. I just wanted to say that there is good data, and a worldwide study just came out very recently, that people care a hell of a lot more than we think that they do. So most people, the majority of people around the world, for instance, said in the study they would give 1% of their salary to climate action. Over half of this, many countries studied, like 90+% wanted more action from their governments. And yet, when they were asked, do you think other people would support this? They said, no, the minority of people would support this. So there is a lot more people that care than we think that they do. And I think, in my opinion, like part of this is because there's been a lot of very clever, kind of powerful forces trying to convince us that this is a too complex problem, it's too out there, or it's that it's also an individual problem, that is our individual carbon footprint, et cetera, et cetera. And so, I think that there is that sense of care, but it's enabling people to see how and where they can be part of the solution and to join together. So, yeah, and I think also just to say that, the policymakers are people too, and we're all going to have our own sort of psychological responses to this. And I know climate negotiators are coming to us saying, their mental health is also being affected often by working in these spaces. So there is, challenges of that to consider as well.
I'm afraid we are running out of time. It has been a very interesting discussion with lots of nice inputs. And just to sum up a few of them, I think the need to bring together is key, be it policymakers and researchers or different communities. So that's a key message to take forward when we're thinking about new research. Another thing that I heard is to actually figure out what works and measure the evaluation, do proper evaluation of the measures that are implemented. And figure more about the drivers of vulnerability, because a lot of this is about the differences in vulnerability that we need to know more about to have more targeted adaptation measures. So I think we will end here. And thank you so much for coming to this session. And